a team of presenters led by Dr. Laurel Buxbaum and Dr. Shailesh Kantak. Dr. Laurel Buxbaum, for those joining online, is the director of the Cognition and Action Laboratory, former associate director of the Institute, and professor of rehabilitation medicine at Thomas Jefferson University, and an award-winning scientist. And shares the podium with Dr. Kantak, who formerly directed the Neuroplasticity and Motor Behavior Laboratory here, and is now an institute scientist and co-chair at the Rancho Los Amigos Rehabilitation Research Institute, Rancho Research Institute, and is actually the title, I'll give you a title right, Shailesh, here for your, it's the co-director of the Pathokinesiology Lab, which is actually a long-standing laboratory there and quite famous, and so it's a very prestigious position. I'm really proud to have you here with us today, a collaborator of many of us actually, but has been working for some time with Dr. Buxbaum. So without further ado, thank you very much for the opportunity.
Thank you so much, Dylan. And let me just check and make sure everyone online can hear me okay. Give a thumbs up. Dr. Kantak, can you give a thumbs up? Can you hear me? Okay, we're not really sure if we can, if they can. I guess we'll find out. Great. Okay, Dylan, and you'll be monitoring. So if there, what we'd like to do before we start is, and I'll introduce our wonderful team, but I just want to let you know, feel free to interrupt with short clarification questions. If you have longer conversational things, save it to the end. Also, as always, we encourage our junior folks to please participate with lots of questions. Okay, so today we're going to talk about limb non-use in stroke, which is a very perplexing and interesting phenomenon. I'd like to introduce to you Shana Zadrao and Alexander DeAngelis, our wonderful RAs on the project, without whom none of this could be possible. We also have online our developer, VR developer, Maxim Karenbach, who's been wonderful and worked with us for quite a time, and without whom none of this could be possible either. So, and of course, Dr. Kantak, who we miss greatly, but we continue to collaborate with him. So I'm going to try to go through this quickly, but we do appreciate the generous support of the Shrier family for this lecture series. I also need to let you know that you can earn CE credits, CME or CE credits. Here's the information. This is the code. I'll give you a second to write it down, 38781. And then we have no financial relationships to disclose. Here are the objectives, which went out with the talk. At the end of this, you should be able to describe the phenomenon of non-use, describe a naturalistic test of actual amount of use, and list at least one cognitive factor that may influence whether individuals who have the capacity to use the more affected arm actually do so. Okay, so we're going to describe what is arm non-use. Now the non-use phenomenon has been described starting in the animal literature shortly after an induced stroke in mice. Animals, despite the ability to use the strength and the dexterity to use their paw, failed to do it. What the name learned non-use was developed as an account of what this phenomenon was. It was a sort of a response to the punishing or non-rewarding consequences of using that paw. And it's since been documented many times in humans, but without a clear story, a clear understanding of the underlying mechanisms of the phenomenon or what to do about it. And we use, intermittently, we'll use the term use capacity disparity. It's a mouthful, but what's important about that is that it describes the fact that it doesn't need to be flagrant complete absence of use of the impaired limb in stroke. It can also be reduced use of that limb. But the key is that it's a disparity in the capacity and the use. So I'm just going to quickly go through this intro, and then we're going to turn it over to the research assistants, and then finally Dr. Kantak will finish up with some preliminary data from our current study. So we know historically that motor capacity, including performance on the Fugl-Meyer, which is a very common clinical assessment of motor capacity, does not explain how often, or how much people use the limb. So here's an example, I hope you can see my mouse, of two patients with essentially the same Fugl-Meyer score. And this is a count of their activity with accelerometers in their daily life. And you can see that for patient number 1 and patient number 2, use of the paretic arm, the arm opposite, I'll use that term paretic quite a lot, so most of you know what it is, but it's the arm opposite the hemisphere of lesion of the stroke. Despite the same overlying capacity, one uses that arm much more than the other. We also know that, and this has been very vexing and perplexing in rehab, is that despite a lot of studies that have used a high amount of practice, people improve in the clinic, their scores improve on the FIM and on the Fugl-Meyer, and then they go home and they don't use that arm. And there's just a well-known study by Waddell et al. That has shown that, and then there are other similar studies showing lack of improvements in the arm use following both OT and robotic therapy. So clearly we need to look beyond whether people improve on a motor score to what people are actually doing with that arm when they get home. So again, I said there were very few theories of what this non-use is, aside from an avoidance of doing something difficult. But what are the factors that might determine whether someone shows non-use in stroke? And we hypothesized, in addition to this reward feedback loop, which is symbolized here, that in this top row, the effort to use the impaired arm is met with decreased success and punishment and pain, and that leads to reduced use, which gets you into a feedback loop of further reductions. At the same time, there's an increased use of the lower effort, the intact limb, associated with more reward and therefore by further use. And this is kind of a reinforcement in maladaptive plasticity. But what we added here was a consideration of the fact that stroke doesn't only affect sensory motor function, as we well know. It affects cognition, it affects arousal, it affects attention. How might these cognitive factors play a role in whether people use their arm or don't use their arm? And those cognitive things had been completely ignored to this point. So we have a series of studies that I'll show you today. And in addition to giving you the groundwork for what we're going to talk about in our ongoing study, it also illustrates a process in science that I think can be useful. And in terms of thinking about starting small, doing a proof of concept, and then gradually expanding to a full-scale multi-site or a large study, as we're doing now. So study 1 was a small study that I conducted with a wonderful collaborator, Carolee Winstein, who many of you know is a real leader in the field of neurorehabilitation. And we conducted at 2 sites, and it had an aim to try to understand, preliminary understanding of the factors that predicted non-use. And the hypothesis was that beyond motor capacity, attention, and psychological factors would predict non-use. So the first thing I want to show you is that we gave subjects something called the actual amount of use test, which I'm not going to describe in detail here because Shauna will be telling you about it. We've actually included it in our new study. Suffice it to say for now, a measurement of everyday naturalistic tasks, like putting photos in a photo album, and it's done in 2 situations. Once when patients are allowed to use either arm, and another where they're constrained to use their more impaired arm. And the disparity between what they can do and what they do when left to their own devices is the index of non-use. So on this y-axis, we have a measurement of non-use that is bigger disparity scores, means more severe non-use. And on the x-axis, you'll see this upper extremity Fugl-Meyer. And here, these are mild patients at the top end, mild motor capacity impairments down into slightly into the moderate range. But what I want you to pay attention to is this upper right quadrant, where people have mild motor impairment and severe non-use. And there's quite a cluster up here, right? So these are the patients we're particularly interested in understanding. Now, in this preliminary study, again, small sample size, but we just also wanted to get a feel for whether anything we ran a background testing battery, and we wanted to see whether any of these factors predicted non-use or were correlated with non-use. And we gave them something called the confidence in arm and hand movement assessment, which is a measure of, to use an OT term, self-efficacy, which really just means, as far as I can understand, really means your confidence in your motor abilities. And then we also gave them something called the virtual reality lateralized attention test. We'll be describing that later, but it's a test of both generalized arousal and attention, as well as lateralized inattention / neglect. So how much do you attend to one side of space versus the other? And this VR lat total score was pretty strongly correlated with non-use. That's that arousal attention non-lateralized measure, as was the confidence in arm and hand movement score. And when we did a multiple regression, again, small sample, but only the VR lat survived as an independent predictor. So we thought, okay, well, we're getting a signal here. Again, early studies. Do you have any evidence that you're getting something that might be of interest to pursue? So in our next study, which was led by Dr. Corey Potts, a former postdoc in our lab, who's now and in a joint postdoc of mine and Shailesh's, who is now a professor at SUNY Plattsburgh. Corey did a really interesting study, I think, which sought to manipulate the factor that we hypothesized was underlying or one of the causes of non-use. So it's going beyond sort of this general proof of concept to, if we modulate or manipulate attention, we should see worse non-use. So that's what we did in study number 2. We know there's a little bit of background about cognitive demands influencing arm choice in neurotypicals. I think there's 1 or 2 studies, but it's had never been shown in stroke. And then we also wanted to look again at what factors might predict non-use. So in this study, another small study, we had 20 individuals with chronic stroke. They could perform these tasks. They could understand the instructions, and they all performed this VR lat test, which, as I mentioned a minute ago, measures generalized attention as well as lateralized attention. So I'm just going to quickly show you how we manipulated these task demands. There were 3 conditions in the VR environment. Sorry about that. There were 3 conditions in the VR environment. In the basic condition, people were they're all wearing a headset in all of these conditions, and they are told on each trial what their target is, and they're told to simply reach out and point in the VR world using the hand of either of their choice to point to the target. Now, in most situations, it's more efficient to use the arm closest to a target to reach to it. You don't want to cross midline and reach. That's inefficient, it's more difficult, it's slower. So think about keeping each hand in your own hemispace is sort of the ideal. And now let me explain the conditions. So in the basic condition, we borrowed what we know from semantic studies in cognitive psychology, which basically have told us that it's easier to find a visual target in an array when it's in an array with distractors from different categories. So the target pops out more. So for example, here we have an array where the target was a pair, and it was presented with these distractors from various categories. In the hard condition, the target might same thing, might be a pear, but it's presented with other fruits and vegetables. And then we also had a dual task condition where we had a hard, difficult array, as well as a requirement to respond to a high-pitched tone, but not a low-pitched tone, by making any kind of vocalization. So they had to do this monitoring thing. And when I say any vocalization, we chose that because we know there are some aphasics in our study, and we didn't want them to have to program any words. Nevertheless, we can come back to this if people are interested, but it's of interest that sort of audio motor task was disruptive for some people, and I'll tell you that in a minute. Okay, so now I'm going to show you a bit of our results, because there were a lot of them, and this is just to keep it simple. And what we've plotted here is reaches on one side of space, and we with on the paretic side of the space is what we're plotting here. And so what we wanted to focus on for this talk is what happens on that paretic side of space. Do people reach over with the non-paretic arm into the paretic side of space? And is that pattern affected by cognitive load? And the short answer is yes, they do. If you look at this, the colors, the blue means paretic arm, and the gold is the non-paretic arm, so a weak arm or stronger arm. And here's the basic condition at the top, hard condition in the middle, and the dual condition in the bottom. And you can see, just visualizing it, that the proportion of yellow, gold, goes up as the load increases. And for the left CVA, we really saw a big difference between the basic and the dual. For the right CVA, we saw a biggest difference between the basic and the hard. So again, we have now experimental proof that manipulating attention reduces efficiency of arm use. People are doing inefficient cross midline reaches more under cognitive load. The other thing we looked at, and this is beautiful analyses by Dr. Potts and Dr. Kantak. We have kinematic motion tracking, and we looked at reach curvature. So in most circumstances, an efficient reach is a straight reach. You want to go right to the target. Interestingly, under cognitive load, you can see compare this dual deviation reach from that curvature increases under the cognitive load. So not only is their choice affected by the load, the low-level motor performance is affected by cognitive load. Now, again, that's not been shown in stroke. It has been shown in neurotypicals. I find this work quite interesting. We had a talk by Dr. Song last year at our Visiting Scholar series, who's shown that cognitive factors do influence reach curvature. And we also are starting to see a lot more evidence that cognitive factors affect walking. And there are a lot of dual task studies coming up in walking. Now, I think ours is one of the first, if not the first, to show that this cognitive load disrupts reaching as well. So under greater cognitive demands, participants use their non-paretic arm while reaching on the paretic side workspace. Right CVA showed a larger decrease in efficiency, while left CVA, I didn't really get a chance to say, showed declines in performance with RT. And beyond capacity, we also found that lateralized attention in this study, lateralized attention predicted performance. This is another way to summarize. Cognitive load plays a crucial role in arm choice. I didn't talk about the control data today, but if some of you might be interested, we found the same pattern in control. Cognitive load reduced efficiency in controls. We also saw some hemispheric specific differences, and we saw one of our predictors, lateralized attention impacts non-use. And so now I'm going to introduce our ongoing study, this is an NIH-funded study. We have 3 aims, which we will be, I don't know that we're presenting much data that is going to conclusively speak to any of these aims today, but the analyses are in process. Our overall goal is for us to recruit 100 subjects. A1 is to determine the sensory motor demographic, neuropsychological, and motivational correlates of non-use. A2 is to determine the neuroanatomic biomarkers of non-use. I definitely won't be looking at that today, but we're looking at resting gold and diffusion tensor imaging to look at whether disconnectivity predicts non-use. And then 3, we're validating a virtual reality test, which is easy to administer, can be done in any office, any room, anywhere, and it doesn't even need to be in a clinical setting, it could be an office building, that will hopefully ultimately predict who's at risk for non-use. And now I'm going to turn it over to Shauna. Thank you.
Thank you, Laurel. So Alex and I are going to go over the methods for the current UCD study. And to start off, we're going to discuss the participants that we include. We only include individuals with a single group or right hemispheric stroke. All stroke participants must have some type of arm weakness and must also still be able to reach to shoulder height. All stroke participants must have at least a score of 30 on the upper extremity Fugler, and all of our participants, including the controls, are right-handed or ambidextrous. All of our HMAX controls score above an 18 on the phone MOCA before being enrolled, and all of our stroke participants score a 4 above on the WOB comprehension. And we currently have 25 chronic CVA participants and 12 controls. So first, I'm going to discuss the actual amount of use test that Laurel mentioned earlier. All of our stroke participants go through this task and they are put through the spontaneous version first. They have 14 tasks to do and they're told to just complete them however they would like to. We actually do this right after the consent process, so they are videotaped without being known. And we watch their arm use in the spontaneous version. Once they're completed the spontaneous version, we then ask them to use their paretic arm in the forced version, going through the same 14 tasks. After they go through both versions of the task, we get a non-use index, and that's the equation right up on the top right. And scores range from 0 to 1. 0 is more low non-use, and 1 is higher non-use. And I also have an example of an RCVA from our study, or the current study, going through both the spontaneous and the forced versions of the actual non-use test. And his non-use is a 1. It's actually the highest he could get. And he will be doing the box image right here. So he'll be opening this box and taking a card out of it. First, this is going to be the spontaneous version. He is using his right arm, which is the non-affected arm, to take out a card. And as you can see, he doesn't even attempt to use his affected arm. In the forced condition, he uses only his left arm, does not even bother to use his non-paretic arm as support. He's fully able to use his paretic arm. So he's a good example of our use capacity disparity. All right, next, we also give out accelerometer watches or actigraphs. These calculate both arm movements for 90% of the waking hours over 5 consecutive days. And once we get the data back, we calculate a use ratio, which is the duration of paretic arm use over the non-paretic arm use. And they're instructed to use their hands as normal. And then after we get that use ratio, the more they use their arm, the higher the use ratio is, and vice versa. Next, some of our sensory motor background measures include the upper extremity Fugler, as Laurel mentioned earlier. We do not include anyone with a score of below 30 to ensure that everyone can use their paretic arm. And the next thing we usually do is Jepson-Taylor hand function test. I have an example of the equipment in the top right corner. This assesses fine and gross motor function, motor hand function using simulated activities of daily living. We also do a box and block measure, which is a really quick measure of unimodal dexterity. And lastly, we use the semi-Weinstein monofilament to evaluate light touch perception deficits in the hands. And there's an example of where we took on the hands, as well as a monofilament. Some other assessments that we use are the NIH stroke scale, pinch and grip strength, as well as elbow proprioception. Lastly, we have some measures of attention, self-efficacy, and effort and reward. So we use Laurel Buxbaum's VR-LAT, which evaluates the lateralized spatial attention and non-lateralized attention. All of our participants drive down the road using a joystick and are asked to name only the statues and the colors of the trees. And we are able to see their non-lateralized attention and arousal from that. Our psychological questionnaires are a self-evaluation apathy questionnaire, a CAM questionnaire that Laurel also mentioned earlier, which is the confidence in arm and hand movement. And then we also use the Connor-Davidson Resilience Scale, which is the ability to cope with stress. And lastly, we also implemented a KINAR task that was done by Aaron Long and colleagues, and it's explaining the willingness to expend effort to expend effort for a varying hypothetical reward. And now Alex is going to go through the VR portion of our methods.
Okay. So within the current study, following this background battery of tests, we have the virtual reality non-use 2 test. So this is similar to the VR NU1 test that was previously described in the study with 48 pots. The participant, as you can see here, is placed in the virtual environment with a physical desk in front of them in which their hands will rest on for their starting position in the task. They're informed to reach as quickly and accurately as possible for a target object that populates on the shelf. Again, similar to the VR NU1 task with a surrounding array of objects. While doing so, their arm choice, their reaction time, their movement time, and reach curvature are all being recorded. And this is just a breakdown of the actual trial itself, what it looks like. So at the very beginning, we will have somebody place their hands in a starting position, physically resting on the desk. After some time, there will be a fixation cue that appears right in front of the virtual shelf. This occurs for some time, following which there is a 2D version of the target object that occupies the shelf. In this case, you can see a piano is the target, moves on again. Another fixation cue occurs for a very varying amount of time, following which the shelf then populates, including the target object. The participant must reach, and once they actually physically make contact, in this case, the shelf will reset with the next array of objects. And so within the VR NU2 test, there are varying conditions as opposed to the VR NU1 test. So instead of having now the dual test condition at the end, we have what can be broken down as the basic grasp, complex grasp, complex point, and then later on the rewarded grasp conditions. To kind of summarize what the difference these things are trying to do. Between the basic and complex conditions here, we're trying to see the effects of cognitive demands and how that modulates arm choice during this task. Between the effects of grasp and point conditions, we are trying to see the effects that a motor task demands and how that modulates arm use. And then within the rewarded grasp conditions, which I'll be talking about in the next slide as well, but we're just trying to see how reward now modulates arm use in this case, while keeping the complex grasp condition consistent. So before I move on though to the rewarded grasp condition, I did want to show a physical example of what this would actually look like. So in this case, this participant is going through the complex touch trials. So as you can see here, the target object for them is going to be a lamp. So that is presented here. Their hands are in the starting position. The fixation process occurs. They spot the lamp, simply touch it, and then the process completes itself. And then there is a vocal cue that accompanies the target object as well, just in case the person is not paying attention. Good. So now within the rewarded test, after the basic grasp, complex grasp, and complex point, there's the rewarded trials, like I said. In this case, again, it is a complex grasp. The trials are complex grasp now with the effect of a reward taking place. The reward works that overall, you will earn more points with use of your paretic arm for the target object. As the breakdown of the points and how they're actually earned is set on this slide here. And while doing so, I'll show you another physical example again. The person's points, don't be confused by the number that appears on the top. That is just showing the overall points during the blocks when they're participating. So again, hands in the starting position, band is the target object. In this case, they have to grasp, and that is their paretic arm. They use it on the left side of the shell, therefore they get 3 points.
Can I ask a clarification? So they get more points for using their affected arm, even if they're using it in the less efficient side?
Yes.
Yeah. Okay.
So they earn less points. They earn 2 points. If they're using it on the less efficient side, they actually earn the most amount of points by using it on the efficient side. And then incorrectly grasping the incorrect item is no points. And besides that, though, that's pretty much the breakdown of that task. I want to be handing it over now to Shailesh, and he'll just give a breakdown of the current analysis and data that we have together.
Thank you, Alex.
Oh, sorry, Shailesh, there's a question from the audience, which I'll repeat. Go ahead.
I'm sorry. Sorry, it came off of the point array that you just described. So you said that you do an effort reward trade-off evaluation. Do you do just reward processing evaluation?
Well, we started trying to do a utility evaluation as well. Yeah. So we do Shailesh, we do Aaron's effort reward task and utility task.
And you do the utility.
Yeah. Now the utility, I don't know if we're going to keep running that for reasons that maybe these guys could discuss more, but we'll talk about that later. Yeah, utility being sort of how much is that reward worth to you, and that may not be the same.
I'm mostly making sure that they can tell the difference between the spectrum of feedback that you're giving them.
Yeah, and they're told at the beginning that they are going to earn more money the more points they get, and I'm pretty sure everyone can understand that.
No, I mean, like, sorry, I don't want to derail this, but I think it's important. It's you're saying that you kind of don't want them. The optimal situation is to use your paretic arm in the efficient
reaches. So they get the
reaches,
most points for that.
in the efficient reaches.
Yes.
But they still get points. It's just less points for using their paretic arm inefficiently.
Yeah.
And so what I'm trying to make sure is that like they can process the difference.
That's a good question. Okay. That I don't know. Yeah, that will sort of remain to be seen whether we can map that to the pattern.
If they were intending to game for points,
yeah,
it wouldn't be advantageous to be using their paretic arm and to be crossing.
Well, it would if the stimulus appears over there because you can't get any. I mean that.
Yeah,
it's better than using their.
So that seems a little weird.
Yeah, you think it's weird to reward them for crossing over?
If
if the naturalistic efficient thing is to use the best hand for the task.
Yeah, I mean
the points should be for that.
It may be a philosophical question for sure because do we want to reward them as much as we can? We want them to use that arm as much as we can and get used to doing it. But yeah, okay, that was the decision we made at the beginning. Yes, and
quick clarification.
Yeah.
So they're told that they should earn more points. Are they told about the point structure before the task, or do they learn while they're doing it?
Yeah.
They're told about
the they don't discover it.
That exact thing that I showed you on the previous slide is what
they get that.
Just one quick clarification I wanted to put in, which is we didn't say this, but we familiarize people with all of the target items before the experiment and make sure that they can identify them all. So any failures to do so during the actual trial cannot be attributed to a comprehension problem or a cognitive problem. I think that's important. All right, so we need to stop sharing.
All right, so thank you, Dr. Buxbaum and Alex and Shauna for setting this up. So in the introduction, Laurel outlined the aims that we are doing in this study. And what I'll be doing is I'll be presenting some preliminary analysis from those 2 aims. We have 2 studies coming from 2 different aims. The first one is looking at the sensory, motor, cognitive, and psychological factors that are associated with arm non-use. And in the second study, which is an extension of the work that Dr. Potts has done, where we try to investigate the effects of cognitive and motor task demands, as well as reward on arm choice during the virtual reality arm non-use test, or VRNU. So in the first study, we had two arm use indices from accelerometers that measured arm use in daily life, and we calculated a use ratio, which essentially is the amount of activity units of the paretic arm to the non-paretic arm. And we also calculated a non-use index using the AAUT, which is a arm use a measure in a standardized laboratory setting. And after testing these for normality, we used a Spearman correlation to look at if our AAUT is a good measure of what they do in daily life too. And then for to look at the sensory motor, cognitive, and psychological predictors of arm non-use, we subjected the scores that we obtained from these standardized assessments to a lasso regression. So I'll be presenting these data. But before that, one of the key things, as you all know, we at MRRI take pride in reproducibility and rigor. And so this was the first step that I kind of went to when I got the data. I kind of said, well, does this data that we are collecting in any way replicates what Dr. Buxbaum had done using very similar measures? And there it is. I was pretty excited about just showing that there was a pretty good data match. I don't have any statistical measure to compare this, but it at least looks similar. And we feel that these are the people that show significant amount of arm non-use. So I was pretty excited, and so I wanted to share that. So the first question that we asked of the data was, is AAUT a good metric to reflect real life paretic arm use? So on the x-axis, I'm plotting the non-use index that we get from the AAUT. So lower values are indicate low non-use, while higher values indicate more non-use. And on the y-axis, we have the use ratio calculated from the accelerometer data, with low measures indicating low use of the paretic arm relative to the non-paretic arm, and higher values indicate more use of the paretic arm. And what we see is really a significant Spearman's correlation where between the two measures, indicating that AAUT would be a good metric to reflect what these people are going to be doing in their real life. In the second part, we the lasso regression that evaluated the all of those sensory, motor, cognitive, and psychological measures. Of all the measures that were put in, the regression model retained four measures. One was the box and block difference, VR to lat, the touch scores on the Simon-Stein's monofilament test, and the apathy questionnaire. So as you can see here, this indicates greater the difference between the number of blocks transferred by the paretic compared to the non-paretic arm, which means the greater the disparity between the speed of the two hands, greater amount of arm non-use. Similarly, VR2, VR lat, the lateralized retention measures the number of virtual objects identified between the two sides as they navigate through a virtual path. And so a higher score reflects greater deficit in lateralized attention or neglect. And you see that though that is associated with greater amount of non-use. Also, greater deficits on the Simon-Stein's test is associated with greater arm use. And apathy, which is essentially a neuropsychiatric disorder or syndrome characterized by diminished initiative and diminished interest or enthusiasm or concern, that higher score represents greater apathy, and that is associated with greater arm non-use. So from this preliminary analysis, what we can suggest is that arm use is indeed a complex disorder that is related to the efficiency of the paretic arm relative to the non-paretic arm, lateralized attention deficit, apathy, and loss of tactile sensations. Also, actual use of arm test is a valid test for testing arm use in stroke survivors. Clinically, what this means, we think, or at least I think, is remediation of arm use will need to involve a multitude of interventions that target movement speed of the paretic arm, unilateral neglect, psychological strategies to help apathy, and sensory re-education. Clinically, I also feel like box and block performance of both arms could be used as a simple and quick test to potentially identify individuals at higher risks of arm non-use. Although it should be noted that that does not really take into consideration other psychological factors such as neglect and or apathy. So in the second ongoing study, I'm really going to present very preliminary data here. So this is the extension of the virtual reality assessment of arm non-use. And what we did was we looked at data from controls and participants with stroke. And what I'm going to show you here is the percentage of movements that were performed by the non-dominant arm in age-matched controls and the paretic arm in the age-matched in stroke survivors across the entire workspace. So we are now looking at the percentage of times, the percentage of paretic arm use and non-paretic arm use across the whole, all these 12 locations. And these, I'm going to compare those across 4 conditions of basic grasp, complex point, and rewarded grasp. So just kind of bringing forth what Alex kind of discussed, that these comparisons between the basic and complex grasp tells us about the effect of cognitive demands, complex point and complex grasp tells us about the effect of motor task demands, and complex grasp and rewarded grasp tells us about the effect of reward. These data, what I'm going to show you, are data from 2 representative individuals. One is a person with right CVA, and one is a person with left CVA. They represent percentage of paretic arm reaches in blue. That is the paretic arm reaches, and these are the non-paretic arm reaches across the workspace. I haven't completed the entire analysis, so I'll just be presenting these individual data. And as you can see here, compared to basic grasp, compared to complex grasp, we see a significant reduction in the paretic arm use. When we look at complex grasp and complex point, we do see again a reduction in the paretic arm use. And when the paretic arm use is rewarded, you see a greater increase in the paretic arm use. We see a similar thing in this person with left CVA, whose right arm is paretic, so that's their dominant arm. So at basic grasp, you see a greater use of the paretic arm, which is their pre-morbid dominant arm. And then when they are asked to reach within the complex array, that paretic arm percent of paretic arm use decreases. It again increases with complex point, and when rewards are given, it significantly increases. So we're in the process of analyzing the group data, but I didn't have time to do all of that, so here is what I decided to present. But I was excited about the reward condition because that was a novel addition to the study. The previous 3 were very similar to what Dr. Potts had investigated. And so I wanted to study this. And so because this was novel, I said, you know what, I want to look at this data more. And so what I'm showing you here is the group data for RCVA and LCVA participants between the complex grasp and the rewarded grasp. And that tells us the effect of reward. And again, as you can see, when reward is given, the individuals with RCVA and LCVA significantly increase their paretic arm use, at least in the short term. So this is during the number of trials. So in summary, it appears for the ongoing study too, it appears that cognitive demands do influence paretic arm use in stroke. With higher cognitive demands reduce the engagement of the paretic arm. Motor demands of grasping versus pointing may influence paretic arm choice during reaching, and providing reinforcement for choosing the paretic arm increases the use of the paretic arm during reaching actions. And however, the long-term retention of this effect is not known. As we go further with this study, we are still collecting more data and recruiting additional participants, thanks to our wonderful RAs. Data analysis pipeline is complete, thanks to Corey also, while he helps us with all of that. And the goal is to determine if performance on the VRNU is predictive of our non-use in daily life using accelerometer or AUT, and identify the neuroanatomical correlates of arm use. With that, I would like to thank our funding agencies and our participants, our collaborators, and research assistants, and our VR developer, Max and Karen Back. We're open to questions.
There's no questions in the chat. There's some coming in now, so perhaps we'll start with the floor here first.
Yes, right. And I'm going to field the question to whoever is best equipped to answer.
Okay. Yeah, I saw that it looked like in both the study with Corey Potts and in the new one that you saw more non-use in people with RCDA, right? Mm-hmm. And I was wondering, do you think that's a product of only recruiting right-handed individuals, or do you think a way that attention and monitoring with arm use is lateralized? That you would think?
That's a great question. Yeah, because there is, Shailesh, do you mind if I take a stab at this?
Sure, you can take a stab. If I have to add anything, I'll do that.
Of the side of dominance and the side of stroke is a big factor. So if you're right-handed and your stroke affects your left hand because you're right CVA, then of course you're really not going to use your left hand. You know, it really reinforces. So that's a factor that we have to look at. However, the effective load would not be accounted for by just that concordance factor. So to the degree that we're seeing that people are less and less likely to use their intact hand, their paretic hand under load, that suggests that it may be both factors. So when we have 100 subjects, we're going to be able to look at a multimodal model in which we enter all of those kinds of factors and then see at the end of the day kind of what stands as significant predictors.
There's a question from the chat. This is from Athlete. In the context of attention contributing to non-use, would you expect to see exacerbated non-use in patients with premorbid psych diagnoses beyond apathy, such as ADHD or anxiety?
That's a great question. Yeah, I mean, I think though, certainly if you cannot bring attention or cognitive control, arousal, all of those, whole ball of concepts, if you cannot bring it to bear on using the affected arm, I think that may well have an effect. And some of those diagnoses may be much more subtle. I mean, and certainly, you know, mild ADHD might not play a big role, severe attentional deficits might, but certainly that's another interesting direction for future work. But by the way, while I have the mic, I want to just add one more thing about the long-standing effects of reward, the long-term or longer-term effects of reward, because we didn't get a chance to mention it, but anecdotally, we are seeing in at least a few subjects, we give them a pre and a post reward reaching task, and it looks like at least some subjects are maintaining the paretic arm, increased use of the paretic arm after the reward block, which would be extremely exciting. So to the degree that we have that in enough subjects to sort of analyze who maintains that benefit, I think that's another interesting future direction. Oh, I'm sorry, that's Amanda.
I'm just curious, so in your pie charts, you showed quite nicely that, you know, adding incentives increased overall use of the paretic arm. Do you have any sense of how much of that is sort of the optimal behavior you wanted them to do, or is it just all use? Not necessarily that the latter is bad necessarily, it's just
Right.
gives you more.
Yeah, if we were to look specifically at paretic arm use on the paretic side. And which Shailesh, you're planning to do that, right? You and Corey
Yes.
are gonna take a look at that.
Yes, so that is in the works.
So we don't know. Short answer, we don't know.
But
John,
our reward structure is also such that it would reward them, although in a graded way, it would reward them even within if they cross the paretic arm. So I think when we did this, the big picture was how can we get people to increase that arm use on a more general scale.
Currently, what we've done in Corey's prior study is looked specifically at paretic arm use on the paretic side. And Shailesh hasn't had a chance to take a look at that yet, but that's in the pipeline for sure. John had a question.
Well, a comment about the reward and then a question. I mean, I guess my intuition is that the reward condition is not as fascinating as it seems, in the sense that it seems to me you could account for the entire effect by just saying that you provided clear instructions of what behavior you want to see in the session, which of course in our therapy sessions, we already know we can get people to use their paretic hand because we tell them to, and then when we stop telling them to, they stop doing it. So it seems to me that even the carryover in the next session, you know, we're still in the demand situation, we still have the same investigator standing there. So I really would kind of want to see it mapped onto a reward account rather than a instructional set account, if you would.
Yeah.
My question has to do with, I haven't kept up on the literature on transfer packages, but when this issue of non-use was first sort of being talked about, a lot of people were using a behavioral concept of transfer training into the home environment, which sort of assumes that it's a behavioral problem, not a lot of individual difference implicitly. Do you know where that work has gone? And whether it's successful?
In fact, there weren't a lot of studies that did that. There was, I think, one study you and I reviewed. It was by Taub and colleagues, and it showed that the transfer package was really critical in this carryover. And the transfer package really is a fancy word for getting the patient on board with the goals. So getting the patient to agree, this is my goal, I want to use that arm more. Getting the family and caregivers and everyone else, friends involved with, we all want you to use that arm more and we're going to help you do it. And so offering support, I think there was, you know, telehealth or something. So now, to my knowledge, Shailesh, you can correct me if I'm wrong, but I have not seen any other studies looking at, that was a constraint-induced study.
Right.
So, constraint-induced therapy was very hot for a while, and I'm also not sure how big it is, maybe because it hasn't carried over, but in which people were literally put into an arm sling and prevented from using their good arm. And literally forced to use the bad arm. And without the transfer package, that did not, you know, take the sling off and people go right back to using their good arm again. So I don't know, Shailesh, do you know if the literature has
it reminds me of one. I do and I don't. So I don't know what's the most recent piece in terms of transfer package, but it reminds me of a study where they had a transfer package, but that transfer package was really sort of personalized to the person. So patient was actually taken back to their home environment, allowed to enlist all the tasks that they actually do in their own environment, and then the therapist had asked them to kind of do those, and then given a sort of a contract that during these tasks, this is how you would use it. There were also some sensory cues. So for example, right next to the switch that they turn on, there was a red sort of a mark that was attached that was a reminder for them to use their paretic arm rather than using the non-paretic arm. So there were some environmental modifiers that they had introduced. So but I don't know if that was so it was not just a transfer package, but a lot of other things that were added to this. And they did report improvement in the paretic arm use.
one more question.
Well, we had a question in the audience, and Anna had a question, and then we had another question online. Can we go to Anna's question next? Yeah.
Thank you. I'm wondering whether you see any changes in performance over time while participants are doing the task. So maybe, you know, because I guess, you know, while doing VR, I mean, they can, you know, get fatigue, it can be mental fatigue or physical fatigue. So I'm wondering whether maybe there is a shift in, you know, in whether they're using
early versus later trials.
Yeah, that's actually something we've been looking at is kind of whether there's an order effect as well, because we have seen in some individuals, if they have the basic grasp condition before the complex grasp, they can perform better.
The order is randomized across subjects,
right. But yeah. we have seen that in a few, but then there are others where they don't show that at all. And then it would require more looking into, I would say, because obviously you have to take into account people who have lower Buxbaum scores as well. Are they coming up with things like fatigue, or they are performing worse in their later trials? So it's something that's underway.
Good question. Do we have time for Dr. Mayer's question? Yeah, go ahead.
One of the things about recovery on the motor side is that you rarely get recovery of finger fractionation, and that means manipulate the options. And even in Kantak's study in the late 70s, when he sectioned the parameter attack, he got arm movement back in gross grasp, but he didn't get the obvious finger manipulation. Is there a test for finger manipulation that you could add to your battery in order to determine whether your patients have or have not finger manipulation? Because some strokes will preserve finger but not proximally. So this is a way to see whether they are inclined to reach for something that cognitively they think they might have to manipulate.
Yeah. Interesting question. Shailesh, do you know, can you speak to that? Did you hear the question?
Can you please briefly repeat it?
Sure. Dr. Mayer asked whether we could add a test of finger manipulation to our battery, or do we have one already?
Okay, so two things.
Yeah,
one,
dexterity. He's talking about the Kuiper study with decreased dexterity or distal hand movements being impaired.
It's officially
fractionation. Yeah.
Okay. So on a larger scale, what we could do is look at the arm and or hand measure of hand measure of Fugelmeyer, because that is what measures sort of the ability to individuate individual joint movements. But as a measure of
no, he's not satisfied by it.
Okay.
Grasping. Okay, well, we can talk about that. That's a great suggestion. Yes.
Should we try and squeeze it in? This is from Umesh. He said, he understands, thank you very much, great presentation. He understands that reinforcement reward in the experimental setting can improve non-use, but I'm wondering if you've considered frustration tolerance, and in parentheses, psychological coping deficit, as a non-use maintenance mechanism in daily life. Frustration tolerance.
We don't have a measure of frustration tolerance, and I'm happy to talk to you about that if you have a good one to recommend. Thank you.
Perhaps we can carry on discussion. Or do you want to try one more?
Can I do one more? And I don't know anything. Sorry. I'm just going to throw this out. Okay, being a social worker. I want to ask you, has there been unscheduled reinforcement used, or any kind of change in the reinforcement that is not scheduled? In other words, it's not expected, constantly expected, because sometimes that has more effect because people don't know what they're going to get.
Yeah.
So just a thought.
Yeah, that's a great thought. You know, generally we're getting feedback that what we really want to know is, can we get people to use their arm more in their daily environment? Absolutely, that is a next step question. What would happen if you had accelerometers along with some kind of ecological momentary assessment that could, you know, provide a reward when people were actually using that arm? That's a good job for our developer for our next stage. So thank you. Thank you all very much.
Yes, thank you.
Thank you very much.